And welcome back to the show. The Coalition for Asian American Children and Families is the nation's only Pan-Asian children's advocacy organization aiming to improve the health and well-being of Asian Pacific American children and families in New York City. Now, CACF provides grants, technical assistance, as well as training to support and strengthen the capacity of Asian Pacific American community-based organizations. Joining us to share now more in this discussion, we are pleased to be joined by the co-executive director of the Coalition for Asian American Children and Families, Vanessa Leung. And thank you, Vanessa, for being with us.
Thank you so much for having me.
I gave a little intro into your organization, but for people who want to know a little bit more, tell us a little bit more about the organization.
Yes, so CACF, we were founded 35 years ago. We were founded by social workers and social service providers in 1986 here in New York, who felt that our government was not ready, nor prepared, nor understood the needs and the needs of our diverse Asian American community, as well as really prepared to meet those needs in a really culturally responsive and a language accessible way. So it was really important for those providers to feel like they could come together as a united voice to really uplift the stories of those children families who are really struggling in New York. And every day, CACF does our work dispelling the model minority myth. The model minority myth is basically this assumption, a stereotype that all Asian Americans are successful, they do well, they're quiet, they don't rock the boat, they put their head down and work hard. When in fact, there's so many who are really struggling with poverty, struggling with limited English proficiency, struggling to navigate the really complex systems of supports that the city provides. We also know that the model minority myth in some ways creates this this way that our government doesn't need to be held accountable to those who are struggling, because it erases those struggles from the community. We also know that the model minority myth has been used to justify underinvestments in other communities of color as well. And so our belief is that every day we need to fight racism. We need to fight racism together. And we need to make sure that we're building strong coalition of the diverse AAPI community that represents the East Asian, South Asian, Southeast Asian, Pacific Islander communities, but as well as draw strong connections and ties to other marginalized communities here in New York. So that is at the heart of our work.
Yeah. And so when we talk about advocacy, I know that you're big on the area of advocacy. You've got some things that you're really dealing with. Talk about some of the policies and the initiatives that you're dealing with right now, front and center.
Yes, so some really cross-cutting issues that again erases our community's needs is the lack of good data. And we all know that oftentimes government uses data to be informed of what policies they need to push, what kind of community response there needs to be. And what we've seen is oftentimes data on Asian Americans are not collected. And when it is, it's kind of just subsumed under this one umbrella. What we know what happened with COVID-19 and the pandemic, when we actually tried to, as a proxy, disaggregate data by last name, we saw that those with Chinese surnames actually have a huge number of infection rates that were hidden when we looked at city averages for the Asian American community. We also saw that South Asian surnames had a really high increase of hospitalization, when again, it was hidden when we didn't see it in the average Asian American numbers. So much of our work, and we've been working on this for decades, is to ensure that we have better data, that our city and state agencies collect better data so that there can be better policy and community responses to meet those needs.
Yeah, I didn't mean to cut you off. I want to talk a little bit about Access Health NYC, because I know that's very important to you, and really having access to good health should be for everyone, but particularly here in New York City, you're doing a job in terms of advocating there.
Yeah, so Access Health New York City, it is one of our collaboratives that we work across communities of color throughout the city and marginalized communities. Those who are really struggling to access the quality healthcare and health insurance and services that are really important and kind of need that assistance, whether it be language assistance, navigating the complexity if they have, you know, if they are have issues around long-term implications of their health and really need to understand all their options. Oftentimes, I think what we've seen is there shouldn't be people who are not wanting to know about their health and fear about going to a doctor because they're scared they won't be able to afford it. And so Access Health provides those opportunities of knowing as patients what your Bill of Rights are, helping to navigate the complex systems of assistance that may be available to folks, even if they are undocumented, even if they're struggling with long-term health concerns.
And budget equity is also a topic of discussion for you. How do you see budget equity and how it affects you and how it affects your constituents?
Yeah. So, budget policy, not the most exciting thing, but we do believe that budget policy is social policy. It's what, folks want to invest in and what is important to them. And so for the AAPI community and for actually a lot of human service organizations in communities of color, led and staffed by people of color, we see that there's actually a real lack of investments of government agencies to those organizations. This past year, when we saw a real increase in anti-Asian hate incidents, when we saw certain communities in the AAPI community actually see impact of the COVID-19 pandemic way before the shutdown, our community-based organizations were the ones that were present to help those families navigate a really difficult and challenging time. And many nonprofits, I think across the board, do this not because there's all this money in state, but it's actually part of their mission. And so while we've historically seen underinvestments across our communities, that was part of our fight to ensure that at the end of the day, communities that are in need get the resources that can really help them get through really difficult and challenging times, but also make sure that these are things that have been happening for a really long time. And maybe because there was a bit more attention this past year, we were able to kind of win $4 million from the city council, additional investments from the state. But we need to make sure that this is around long-term healing, long-term recovery. That's really important. And that at the end, we want to make sure that we stand together as a community, ensure that a budget is never balanced on the back of those who are in need.
Yeah, everybody's been affected by COVID-19, but can you give us a little bit more insight into some of the challenges and things that you can give us when it comes to the AAPI community and how they've had to deal with COVID-19 and the effects thereof?
Yeah, I mean, I think we've all seen some of the epicenters of the initial COVID-19, but we're many parts of Queens where there are large immigrant AAPI communities living. And we all know that when those who have already historically been marginalized in systems, navigating and trying to get through a pandemic is that much harder. When we heard about when COVID-19, before the shutdown, we already saw that certain communities, particularly Chinese community neighborhoods, those small businesses were struggling back in the beginning of last year. People were not coming, tourists were not coming. People were avoiding those neighborhoods of Chinatown, Flushing, Sunset Park. Those businesses were already seeing huge declines in their businesses. And then when the shutdown happened, for so many small business owners who may not, English is not their first language, navigating what was available to them, trying to get a PPP loan was not really accessible. Those continue to be challenges for small businesses across the board, but even particular for immigrant communities, it's that much harder to navigate. I think we also saw a huge, I think in certain challenging times, people like to identify a scapegoat, want to be able to blame somebody or something. I don't think it helped that our previous federal administration did not really unite our country and actually identified the virus as coming from China and naming it things that I think it made basically put a target on those who are East Asian presenting. There was a level of fear for folks around even just going to do their essential work that was really important. And I think that is really one of the things that are concerns for schools when schools were returning this year, is making sure that our young people and our families have what they need to feel safe. And when we want to define safety, we want to say that it's really about the presence of wellness. It's not about this absence of crime or the or kind of decrease in incidents overall, but actually making sure that communities have the resources and the services that they need to feel supported in their communities, making sure that they have the connections to people and making community connections across neighborhoods, so that there is this real feeling of being connected and being in this all together.
You led into my next question when you talked about the previous presidential administration and really the work that the rhetoric that was actually coming out of Washington, D.C., saying that it was the Wuhan virus and coming out of China. And that really did, because I did a couple of stories, really did affect businesses, particularly Asian American businesses, because of the stereotypes and the false information that was actually spread. Can you give us a little bit more insight into what you've learned in terms of how businesses were actually affected and how people actually who were essential workers actually had to really struggle and make it through, given the fact that you had this kind of stereotype and false misinformation that was hanging and looming over their heads?
Yeah, I think it was probably a really dark period for so many folks, in trying to be, the businesses were the only ways of actually being able to survive, right? That's what their livelihood was. And I think it became something that they had real concerns. We heard of businesses having to shorten their hours. There was a time when they were trying to, there was lots of just concerns about how they were going to make their monthly payments that they needed to do. There was just really a lot of concerns about what will happen, given that this happened even before the shutdown. The businesses not being able to have the same amount of folks coming through, they paying and being able to pay their workers. We heard a lot of folks who lost their jobs. And I think this is kind of where for CACF, we were able to start an emergency fund that many of our member organizations were able to distribute to folks who really just had no other options in terms of being able to survive through that pandemic. And so hundreds of thousands of dollars went through to really support families on the ground as they were trying to navigate this kind of downturn in business.
Yeah. I want to take a moment to talk a little bit about Project Charge and the work that's being done there. Make our viewers a little bit more aware of your Project Charge.
Yeah, so this is our health collaborative, really around, centering it like Asian American. What does it mean to have health equity for Asian Americans? And I think some of the key things that constantly come up are the challenges of navigating a healthcare system when English is not your first language. We've seen it through the pandemic when difficult decisions had to be made about who got health services or not, when there was an overworked healthcare workers who were trying to meet the needs of a number of folks and being understaffed themselves and having to make split decisions about who gets care and who doesn't. And when there was this need to find an interpreter, we've seen that actually becomes a deterrent to actually being able to provide immediate assistance. So Project Charge is really looking at addressing some of these issues systemically around the lack of culturally responsive systems, understanding, a system that may not understand the myriad of cultural challenges to accessing quality healthcare, The fact that so many within the AAPI community come from limited English proficient families. That means that nobody over the age of 14 speaks English well or at all. And we would never want to see a young person have to be an interpreter in a medical situation. But we've seen that happen before as well. So these are the things at Project Charge. We work as a collaborative to look at how do we increase the number of access for families to quality healthcare, affordable healthcare, and ensure that the needs of the diverse community are met.
Yeah, we know that 21% of Asian Americans, New Yorkers, are actually considered to be uninsured. And then also almost 40% of Asian Americans in New York City are actually enrolled in Medicaid. And so certainly some huge health challenges there. And I know that you're on the front lines dealing with that. If people want to get connected to helping to support the Asian American community, your organization, how can they go about doing so?
Yeah, you can, visit our website at www.cacf.org. And then we can also connect to community-based organizations that, serve the diverse Asian American community throughout the 5 boroughs. So as our members who are on the front line, who are direct service providers, they are language specific, ethnic specific, kind of issue specific in their services. But, together we come together as a united voice to ensure that we are united to fight for those most marginalized in our communities.
Vanessa Leung, it's been great having you, and thank you for the conversation and the awareness, and continue the advocacy. And we, of course, will continue to spread the word as well.
Thank you so much for having me.
Thanks, Vanessa. All righty. Well, we want to let you know we do have more show. We want you to stay with us as the Social Justice Forums continues. We'll be right back after this brief messages. As I get and it gives me a break so I can get my words together. We'll be right back.